Doctors of Reddit, what patient made you go, how the fuck are you even alive?
As a med student on my emergency rotation, I had a guy brought in who had fallen off a 7th or 8th floor balcony and landed on his head. Essentially DOA, and we couldn't get a blood pressure when he got to the hospital. As a student, my job was to basically stand to the side and squeeze the bajillion bags of blood that went into this dude. His cervical spine was essentially dust on the initial CT scan we got. I figured he probably wouldn't have made it, but about a month later I'm now on my ICU rotation and I see this guy awake and conscious. Pretty crazy.
Any update on his condition? Crazy.
I work in trauma and once had a guy fall off a roof. He said he remembered hitting the bars on the scaffolding on the way down. We originally thought he'd fractured his femur, but nope, just a small hematoma. He was in bed next to a man who had broken his ribs and had a small C-spine fracture when he fell forward picking up his keys.
A friend of mine had to get his entire leg amputated because he slipped off the bottom step of a ladder, and bent his knee backwards. It apparently pinched some type of main blood vessel as his entire leg eventually got necrosis when they had him in the hospital. They tried to helicopter him to some other hospital, but there were high winds, so they had him sitting there with the necrosis spreading. Over a stupid 1-foot slip.
My dad is 87. He had prostate, liver, bowel, colon and skin cancer. For the skin cancer he had lots of reconstructive surgeries. His whole tibia region and the back of his hands. Every year he has to have at least one skin lesion removed. He had a couple of heart attacks and then a sextuple bypass surgery. He also had a big pneumonia, a huge abscess and a small stroke. His doctor wants to see him every 6 months. I think just to be amazed that he's still walking around.
If I were a doctor or scientist, fuck every 6 months, I'd want to see this guy weekly so I could study him and give other people his immortality.
We had a guy with a major aortic dissection one night. From the bedside ultrasound, he looked like he had already bled out. He had some chest pain, but he was alert and oriented, and we were shocked he was even still alive. He absolutely shouldn't have been with how much blood we saw and the size of the dissection. We called the surgeon in, who was really blunt, and explained to the guy he was probably going to die in surgery. He was a young guy, like late 40s, he was on a business trip, and it was completely unexpected. He kept trying to call his wife, but it was like 2 a.m. and she wasn't answering. He just wanted to talk and tell her goodbye. It was actually pretty devastating to watch. Meanwhile he's so coherent and alert, as if he isn't actively bleeding out and dying. Most patients we would get in the same situation wouldn't be conscious or would already be dead. They swooped him off to surgery before he could contact his wife, and the dude lived. Remembering that story got me through a lot of tough years in the earth, because I think it just reminded me that hope and good outcomes are still out there. During residency, my ICU patient had to have his chest reopened less than an hour after 6-hour open-heart CABG surgery. He needed 12 units of blood, his heart massaged then shocked 4 times. Cardiothoracic surgeon in the ICU operating because no time to go back down to OR. Was an illicit drug abuser and alcoholic. Nurses called him the cockroach. I checked in on him for 4 weeks. He was unresponsive every day. On week 20 we had to consult and to take maggots out of his nose. I was sure he was a goner after that. Week 3 passed, no change. Week 4, day 24 I believe, at 6 a.m., he opens his eyes. I was shocked. He has a permanent tracheostomy now, but somehow is alive.
How the hell did he get maggots in his nose?
Currently in residency, but this was a patient I saw in medical school. This one has more to do with a patient's past medical history instead of anything acute. Had one patient in one of my internal medicine rotations who was admitted for hip surgery, who was one of the nicest, sweetest people I've ever met. Her surgery was pretty routine and there were no complications. In her past medical history, she was diagnosed with stage 4 endometrial cancer that had spread to her brain. Apparently she had undergone chemo, radiation, primary tumor resection, and surgery to remove the brain met. She remained cancer-free since that period. The fact that she had undergone that whole ordeal and appeared to be mostly healthy and was in remission from her cancer really blew my mind.
Very nice.
Lady in her mid-30s was in the clinic for a 1-week follow-up post-foot amputation, diabetes. She was admitted straight from the clinic because her blood glucose was 600 mg per deciliter, normal as 80 to 120, and the wound was severely infected. We used super concentrated doses of insulin to bring it back to the 200s. She was on strict diet restrictions and we couldn't figure out how it wouldn't drop any lower than 250. Turns out her kids, teens, had been sneaking giant 64-ounce sodas and candy bars into the hospital, literally 1 week after we chopped her foot off because of uncontrolled diabetes. Not exactly a case of how the fuck did you survive that trauma disease, but how the fuck do you even function on your own?
I know a guy who keeps telling me that he never takes insulin and drinks 40 ounces of dew a day and his diabetes hasn't caused him any problems yet. Same guy also had his foot amputated a few inches above the ankle a year ago.
A guy the first took care of during my residency, fucking cyborg. I was the chief on trauma. Got a page about a patient en route with a stab wound to the chest. When the patient rolled into the trauma bay, he had no pulse. He had been stabbed in his left upper chest, 3 centimeters below clavicle. He got an earthorocotomy. If you want to feel like a badass, then do an earthorocotomy. We were able to cross-clamp his aorta. We took him right to the OR. We oversewed one small artery below his rib, then transported him to the ICU still intubated. 8 hours later he was extubated and wanting breakfast. Seriously, dude? He was dead 10 hours before. He was also a complete asshole. No wonder someone stabbed him.